This is Selma Schimmel, and this is Unique and Unmistakable Amsterdam. The cultural and commercial capital of the Netherlands is used to being the center of attention, and this year is no exception as it hosts the European Cancer Congress 2013. This is a multidisciplinary cancer congress sponsored by ECHO, the European Cancer Organization, ESMO, the European Society for Medical Oncology, and ESTRO, the European Society for Therapeutic Radiology and Oncology. Bringing together the most imaginative and innovative minds and researchers from across the continent and around the world to engage global stakeholders, coordinate a unified oncology community, and speak with one voice. Vital Options Advocacy in Action is here to do the same, bringing together influential leaders of the cancer advocacy community for a three-part advocate forum. This is our fourth European Advocacy in Action, and we are so proud to be in Amsterdam, grateful to be partnering with ESMO and ECHO, and honored to bring it to you. We hope by the time you leave this session, you may have a new definition, an expanded definition of what palliative care is. And I'm going to start with you, Dr. Cherny, about addressing the need to redefine palliative care as a quality of life issue rather than an end-of-life issue. And how do we begin to introduce it sooner into the clinical consultation so it becomes part of the continuum of care?
I think that there's been substantial confusion as to what palliative care is, which often becomes a barrier for both physicians to refer patients to palliative care and for patients and their families to ask about palliative care. I think there's a common misconception that palliative care is really only about end-of-life care. And this is a really major misconception. Palliative care for more than 20 years has been recognized as being a tool to improve the ability to live with advanced illness, as well as to ensure that people can end their lives comfortably. But it's not only about ending one's life comfortably, it's about living and living well, physically, psychologically. Palliative care for more than 20 years has been recognized as being a tool to improve the ability to live with advanced illness, as well as to ensure that people can end their lives comfortably. But it's not only about ending one's life comfortably, it's about living and living well, physically, psychologically, socially, and spiritually. Palliative care is needed pretty well by most patients with advanced cancer, but also by many patients with early cancer who are troubled by symptoms either related to their disease or troubled by symptoms related to their treatment programs.
I know in the US, one of the goals is to bring the discussion of palliative care early on in the clinical consultation, to begin to demystify it.
This is not only in the US, this has also been a major part of the whole ESMO palliative care initiative, which has been going on since 1999. ESMO has been really taking a lead in pushing the agenda of making palliative care an integral part of oncologic care, such that all patients will be asked about issues that may be undermining their quality of life, and encouraging physicians and cancer services to bring palliative care services as part of an earlier phase of cancer care, not just a late phase of cancer care.
So if a patient or a family member was to ask you to define palliative care, how would you define it?
I get asked what I do all the time.
Yes.
And what I explain is that it's my role to help to look after patients' quality of life, to ensure that they can live as well as they can, as long as they can. But if and when we get to a situation where the disease can't be cured and patients are approaching the end of life, also to ensure that they're comfortable and that their families are well supported during that process.
Thank you, Dr. Cherny.